Frail, weak, and fighting for their lives. These are the faces of Yemen's latest crisis. Preying on the weak and hungry. Cholera has rapidly spread throughout the country. This hospital, already crippled by war, is overwhelmed. Badra and her family arrived in the capital after their town was heavily bombed. She hoped her children would be safe in the city, but 2 days after moving here, their lives are at risk again.
The kids went to play, and then they started cleaning the rubbish outside. My son washed his hands, but just after dinner, he got really sick.
Yemen is a country broken by war and hunger. A place where the young and old become the first victims. It's always been poor, but 2 years of fighting has left it unable to cope with this emergency.
The war has meant that everything is deteriorating, especially the health system. There are no medicines, no access to clean water. It's catastrophic.
Outside, the patients keep coming. But without spare beds, they're treated in the courtyard. With over 200 new cases arriving each day to this hospital alone, makeshift tents have been set up to deal with the numbers. Cholera is cheap and easy to treat. But the UN says the delivery of aid has been slowed down by both sides, which means supplies don't reach the people in need. So far, the outbreak has killed over 400 people. Abdul's wife is the latest victim. He buried her here just yesterday. She was so malnourished, her body wasn't able to fight the disease. She was 21 years old.
Her situation deteriorated, so we rushed her to the hospital. They couldn't help her. We took her to another hospital, but by then it was too late. Everything in our life together was so lovely. She was so kind. Our time together was too short.
Abdul was left widowed, and his 6-month-old son without a mother. With no peace in sight, Yemen's war will continue to tear families apart. Nawal Al-Maghafi, BBC News.